Hi guys, we're going to do a glute activation exercise, glute, hip, back, buttock strengthening activation exercises. Now, it's a very important muscles but mostly ignored. Alright, people do sit a lot in front of computers these days. We have to drive a lot. There is a lot of things we actually didn't used to do in old days, but we have to do, which include lots of sitting these days. So these muscles goes weak, and that's why we have hip dislocations, we have a sciatic, we have a back problems, we have knee problems, and lots and lots of people have to go through these hip replacements and knee replacements and back surgeries. Just doing these simple exercises, you can avoid all that. Okay, so let's just start. I'm using a band. If you're a beginner, you can do without a band, but if you want to work a little bit extra, you can use the band. There's a different levels of bands. You can buy these bands very cheap from a supermarket, online, or a sports store near you. So I'm just using a medium because I want to show you guys what I'm doing. You can pick any level according to your strength, your level, your fitness level. If you're an athlete, pick up the stronger one. If you haven't done any glute exercise, hip exercise before, sorry, it's up to you. You can just choose your own level. You can choose your own way of working your muscles. Okay, but no excuse. Make sure you're doing exercise. No bands. Don't feel poor. Just start doing the exercise, and I'll promise you at the end of the day you're going to feel the same as I'm feeling or other people using the band. So first exercise, we're going to do the gluteus maximus activation exercise. So now see, remember, it's a set of a few videos. I'm just starting very basic, very beginner session, but don't worry, it's not easy. It's hard. You will feel tightness, you feel activation, you feel alignment, and you feel strong at the end of the session. Okay, let's start. We're going to lie down on the back. So just want you to spread your legs shoulder width apart. Feet are slightly turning up. Your arms are resting on a side. Okay, so let's just slide your hands under your hips. So just thumb and index finger. Feet are slightly wide. Back is neutral, ribs are slightly in, and tummies are firm. Zipping up, pull the tummy. Now just, when I say zip up, I'm sorry, I'm just a little bit fast. So when I say zip up, that's your pelvic floor. So to feel like you're just gently zipping and lifting the pelvic floor. When I say pull the tummies, to feel like it's a hollow, it's not doming out. So it's always a hollow. The ribs are not poking out, so they're just slightly in. And the neutral spine, when you have a little curve under your lumbar spine. So feeling both hips are flat on the floor, and they're very even. They're not like on a one side. Even you have a pain, believe me, start making it relax there a little bit, and by the end of the session you're going to start working on all the muscles, and once you activated all the muscles, you will not have any pain and problems. Okay, so just keep it even, zipping up. Also remember, we're not trying to tuck in, so it's always a neutral. So it's breathing out, zipping up, and feel you tightening both of your buttocks. Okay, so let's just hold it here and just let go slowly. Now, let's just breathe out. Squeeze both of your buttocks tight. Now, inhale, you hold, and exhale, you let go. Inhale, you prepare yourself. That is your pelvic floor, flattening the tummy. And exhale, you squeeze the buttocks. So see, it's a bit rising up. And that's okay, that's all normal. Inhale, hold. Exhale, you let go. Breathe in and breathe out. So I'm just changing my hand so that I can show you guys. Inhale, hold. Exhale, go down slowly. Now, if you're connected, I want you to close your eyes now and let's just start visualizing you activating both of the buttocks. So breathing out, tightening. Squeeze it tight. You just listen now. Now make it harder as you breathe in. And as you exhale, you just let go now. I need 3 more. So it's just breathing out. Squeeze the buttocks. So stay relaxed. Thigh muscles, your entire thigh muscles are completely relaxed. Exhale and down slowly. So just show me 2 more now. It's a breathing out, you're squeezing both of your buttocks. Inhale, you hold. And then just exhale, you go down slowly. Breathing in, stay. And as you breathe out, you squeeze the buttocks. You breathe in, you hold. And breathe out, go down slowly. Now you keep your eyes closed, keep listening to me. Now we're isolating this time. So just as you exhale, I want you to squeeze the right buttock. As you inhale, you release the right buttock. Exhale, you squeeze the left buttock. And as you inhale, you release the left buttock. Very good. It's exhale, you squeeze the right buttock. Now remember, we're keeping the left buttock relaxed. Exhale, you relax. So just exhale, squeeze the left buttock. And exhale, you release. So that's just helping stabilizing, isolating and strengthening individual hip. Okay, so breathe out, you squeeze. Inhale, you release. Exhale, you squeeze. Inhale, you release. So when I'm talking, you're still working, all right? So I'm just trying to help you motivate and sort of give you a little bit more awareness about how we're working on these muscles. So exhale, last one on the left, and inhale, you release. So now a little bit more tricky, okay? So more complex here. So it's exhale, squeeze the right. Inhale, squeeze the left as well. So not letting go. Now let go the right first, and then let go the left. Now squeeze the left, squeeze the right, let go the left, and let go the right. Now you're doing right. Okay, squeeze the right, squeeze the left, let go the right, let go the left. There's a still fun trick for you. Squeeze the left, squeeze the right, squeeze or let go the left, sorry, and let go the right. Now let's squeeze the right. So last 4 to go. Okay, so keep listening. Squeeze the left. Now this time you let go the left first and let go the right. Now squeeze the left, squeeze the right, let go the right, and let go the left. Just 2 more to go. Right squeeze, left. So both are tight. Now let go the left, let go the right. Squeeze the left, squeeze the right, let go the right, and let go the left. Wonderful. Okay, so now let's the second exercise, the pelvic curl up. I'm using a medium band. See which level you are. You don't have to use a band. You can just do without the band. So feet and knees hip width apart. We're slightly stretching away from us. Now, I want you to bring both hands up onto your hip bones, feeling your hips are parallel, spines are neutral. Now gently draw your ribs in, neck staying long and head staying relaxed. So let's just breathe out, push onto your heels and slowly, gently peel the tailbone off and squeeze the lower buttocks. Now inhale, and when I say inhale, so you really try to clench your buttocks, hold it, and exhale, going down slowly, 1 vertebrae at a time. It's exhale, we're lifting, just slowly, gently peeling the tailbone off, and just squeeze the lower buttocks harder, and exhale, going down slowly. Now need a 4 more. It's breathing out. Feel both feet or both heels are pushing strongly, ribs are staying in, and your hip drawing towards your ribs. Squeeze it tight, and exhale, go down slowly. Let's do 3 more. Breathe out. Now squeeze it harder and exhale, down slowly. There's always an exercise in exercise, so there's always a breathe out. I'll show you. Okay, squeeze it, push it harder. You feel like you're really tightening, and exhale, go down slowly, just 1 vertebrae at a time. Exhale, lifting up, tighten the lower buttocks. So hold it here. Let's just keep it tight. Arms resting. You feel shoulders are relaxed. Okay, so breathe out, turn both knees out. Inhale and back. So it's exhale, turning out. Inhale and back. Exhale with turning knees out. Inhale and back. So remember, your hips are slightly off the floor. They're not resting on the floor. It's exhale, squeezing and working, strengthening outside of the hips. Inhale and back. So all that hips are working. So spine just slightly curled there, but sort of maintaining a neutral, but not doing this. Okay, so your backs are not hyperextended. If it's that, you're going to hurt your back. Okay, so slightly curl, and that's what we're focusing, isolating our glutes. 4, 3, 2 more. Last one. Nice. Okay, so let's just here tuck in and give me a few pulls. So go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 more now. 10, 8, 7, 6, 5, 4, 3, 2, and let go. You can feel it? Yes. Okay, let's do the next exercise. Is the clam. Before doing the clam, we're going to do a gluteus medius activation. Okay, so just the gluteus maximus we worked before was the upper lying muscles. The medius is in the middle. Okay, so the bottom arm on the middle of the mat, and bring the top hand and feel like you're bringing hand behind, finding the edge of the mat and the end of the mat, and sort of feel like your tailbone's almost hanging on the edge of the mat. Nice. Okay, so heel and tailbones are both aligned, and legs are almost straight, not too close to you like this. Okay, so just almost straight, slightly bent. Now bring the top hand here. Let's just push that waist away, sort of feel like your both hips are on a straight line, a vertical line, and from there roll that top hip forward, sort of feeling like your top hips are falling forward. Now pull the tummy, brace the spine, and also zip up the pelvic floor. Now I want you to now, it's all a concentration. I want you to feel you're pushing that top heel strongly down, and when you're pushing the top heel down, you're trying to lift the knee, but it's not happening. Let's just feel we're tightening the buttock and activating glutes. Inhale, release. Okay, few more. So it's exhale, we're pushing the heel, pulling that femur down to the hip socket and really squeezing the buttock. Inhale, release. So it's all here. It's a power of a suggestion. All right, so just breathe out. Feel you're sending a signal to tighten the buttock and recruiting all the muscles, so all the lazy muscles and cells. Go, breathe out, push that heel, and feel it's tightening. So recruiting, feeling like it's a very heavy weight, and we're trying to lift the knee, but it's not happening. And you're trying to free, and its knees are not lifting, but all that muscle around your hip there is tightening it. They really tighten, screaming at you, and release. Now I need 4 more. I want you to start feeling now that activation, strong activation. Inhale, release. So it's all pretending we're lifting the knee, but we're not lifting. Okay, so just 1 more. Breathe out. Inhale, release. Now let's this time press the heel, keep the muscle tight, and lift the knee up. We call it clamshell. It's like a clamshell. It's trying to open, but it's not opening. So push that heel strongly down and lift the knee, and feel it's still a very hard work for you. Even you're using a band or not using a band, pretend you're trying to lift the leg, and there is a heavy weight on the leg, and that helping tightening and strengthening your hips muscles strongly. So breathe out, you're lifting up, hold, and breathe in down slowly. So always pause a little bit and slow down, not rushing. Okay, a few more. And back. Throw that air strongly. You can in and out through your nose. You can in through your nose, out through your mouth, or you can breathe in, breathe out through your mouth. It's all good. But make sure you're not holding a breath. In an exercise, in a Pilates, you're always breathing in and breathing out. So helping strengthening our cardiovascular, our heart, our lungs, and also eliminating all that lactic acid from our muscles, just regenerating more energy, more strength in the body. So it's exhale, lifting up, hold it there now, hold it for 5, 4, keep it tight, 3, 2, 1, and slow down. You can feel it. Now just give a little tap. Now hip internal, that was the external rotation. Now we're doing internal rotation. So push that knee down strongly and breathe out, lift the foot up. Inhale down, not too much, and also not letting our hip go. It's exhale, lifting, inhale down. Limit if you can, especially girls have a very big internal rotation. Used to sit on a W position, lots of kids. Now breathe out. So the position is not wrong itself, don't take me. But having a different positions, like you sitting on a W, you make your kid sitting on a cross leg as well. And sitting on the thunderbolt position where your heels are under your hips. Okay, so exhale, inhale back. One more. Okay, now let's rest. So that was the hip internal rotations. Now let's just take the band off. Nice. Okay, so let's we're going to do adductor exercise, the inner thighs. Worked on the outer thigh, and now we're going to work on the inner thighs just to balance both. Okay, now see, I'm placing my foot here. You can place the foot here like this. If you're not comfortable, you can place your foot here. It's all right, all okay. But I'm comfortable here, so I'm going to place it here. I want you to point your foot, align the leg, and make your bottom leg straight. Okay, so still there is a little curve there. You're not pushing it down. So exhale, lift the bottom leg. Inhale down. Exhale up. Inhale down. Keep going. I like talking so that you're still feeling, you're still listening, and we're both connecting. I was asking a very famous physio that question, why always the women's have a strong internal rotation. So when you see their knees are knocking, and the men's have a bow legs, it's just like that. So that very famous physio laughed, or sort of not laughed and smiled. It's a very interesting question no one asked. Okay, so lift up, hold it. Okay, now let's just do a few pulls here. So straight, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 5 more. 1, 2, 3, 5, and just hold for 10 now. 9, 8, 7, 6, 5, 4, 3, 2, 1, and let's rest. Good. Now I know what you wanna do. You wanna hear what next, what that physio said. Okay, I'll tell you soon. Okay, so bring your feet forward slightly, hip slightly forward, and a hand here. So you breathe out, pull the tummy and reach forward. Inhale down. Exhale, pull the tummy. So while we're doing exercise, we're talking, we're connecting. Breathe out, lifting up, breathe in down. So just 5 more. Keep the tummy in, so working on obliques. I'm bad with the counting sometimes. Doesn't matter, we're doing exercise, alright? So 1 or 2 extra or less, it doesn't really make any difference. Go up and hold, and let's rest. Okay, let's do the other side. Now, getting up. So we're talking about why the women's have this and the men's have a bow legs. Think about, it's been, you know, the women's have to sit like this with the legs closed, or also wearing a tight dresses, so the knees always closed. But with the men's actually wear the jeans and can sit like this. All right, but it can be different. The women's do ride the horse and play sports. They can have the bow legs too. But you see, doing these exercises, you're never going to have a perfect aligned legs, and that's the whole focus. Perfect strong legs, perfect strong hips, back, core. Alrighty, let's do the other side. Nice. Okay, so arm in the middle, find that edge of the mat and slide the heels back. So heels and hips align. Push that waist away. Pull the tummy, roll slightly forward, zip up. The first is activation. So as you exhale, you're pressing. Inhale, hold. Exhale, you let go. So just exhale again. Inhale. So it's a gluteus medius activation. So breathing out, you're pushing that heel down, pulling femur to the hip socket, pulling the tummy, and feel this tightening. Inhale, clinching, tightening, squeezing, whatever you feel. So really working, really tightening, really hard. Release. Go again. Inhale, release. So pretending we're trying to lift what we're not lifting. Inhale, release. Few more. Go again. Inhale, release. I sometimes say, just a joke of mine, doing exercise involving you. So just keep working. You can see the person's age from their buttock. Breathe out. So 20, their buttocks are up high, 30 goes down, 40 it goes further down, and by the end of the 50 that goes down back to the knees. So 70, 80 maybe hips are hanging down to the heels. Just kidding. Breathe out. Not for people they actually do exercise, just for a lazy people. So push that heel, pull the femur, squeeze the buttock, hold it there, and let just release. Okay. Now, let's do the clamp. So breathing out, we're lifting the knee, and breathing in, going down slowly. So just breathe out, lift the knee up, inhale. So the technique is here, not letting hip roll back, all right? So you here, you're still maintaining that curve, keeping a tummy engaged, and lift the knee. Inhale, release. Clamp one. Inhale, release. Go again. Keep going. You can keep this hand forward here, eyes are staying slightly down, and pulling a tummy, keeping a core engaged. That's just a few more now. 3, 2 more. Last one. Okay, now let's do the internal hip rotation now. Breathe up, lifting up, and breathe in down slowly. Go again. Inhale and back. So not forcing, not overdoing it, and making sure there's no clicking in the hip, but just feel you pushing that top knee down to the bottom knee to lift the foot up. Okay, just do 4 more now. 3. Last 2. Just 1 more there now. Excellent. You're a genius. Good job. Okay, now let's take the band off. Nice. Now, how about I can just show you this one so that you know your legs are straight, and you can do different as well. So here, point the foot, align the leg, zip up, and lift the bottom leg up. Inhale down. So strong mind people always find a reason to do the exercise. They find a time, even it's the middle of the night. They find a way to look after themselves. The people who are weaker, they like to whinge. They find a time to always whinge and cry about their pains and aches. So hold up. And let's do the pulse. Go. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, and hold for 10 seconds. 9. Strong legs. Good. Zip up the pelvic floor. Pull the tummy, and let's just relax slowly. So both feet are slightly forward. So it's on the edge of the mat. Hand here. Roll that top hip forward. Hip staying here. Breathe out up. Breathe in down slowly. So if you have a weak hip, weak back, or your back hurts or your hip hurts, and if you're watching this video, you're doing exercise, you're a strong-minded person, okay? So you're looking after yourself. And if you do this exercise regular for a week, 2 weeks, 3 weeks, you will find the difference. You will find it was just all the weakness in the muscles, okay? So lift up, hold, and let's just go down slowly. Let's do the deep hip rotator activation now. If you want to have a drink, you can have a little drink if you want. I'm just going to keep going because we have a few more exercises to go. Nice. Alright, so this time legs are 90-90. So your arms still on the middle of the mat. Now, 90-90 is when your knees and hips at 90 and knees and ankles at 90. Now, still rolling hips slightly forward, heels together. Push that waist away, pull the tummy zip up, and now push that heel strongly down and pull that femur to the hip socket, and feel you engaging that deep hip extensors or rotators. Now, how are we feeling that? I want you to find that traditional underline and just slide that fingers down to the middle of your buttock there. Now, feel you pushing that heel down, pulling your femur to the hip socket, and you're clenching and tightening that muscle there. Inhale, release. It takes a time sometimes, a few tries, a few goes, and for some people, few weeks to feel it. Okay? So don't rush if you can't feel it. Don't get disheartened or disappointed. Just keep practicing, keep finding it. Release. Go again. But if you can ask a question, if you have any question, just write me a message, or just write under the message box so I can explain to you. Okay, so breathe out, push that heel, feel you're trying to lift the knee, you're recruiting all the muscles there, tightening, and this time not letting go, just hold it there and lift the knee up. Inhale down. Again. So see closely, I'm not touching the knee. Exhale, lifting, because I'm not letting go of that muscle now, because it's tight and it's working, so I want it to keep working. Inhale down. So it's exhale, inhale, exhale, inhale, exhale, inhale. Few more. Go again. Keep working hard. 2 more. Last one. So just hold and do the pulse. Go 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And let's relax. Okay, so now there's another trick for strengthening our internal rotators. So see, we're strengthening our external rotators. We also have to strengthen our internal rotators to keep a balance. Okay, so push it and feel aligning again. Now, push the top knee to the bottom knee and lift up against the resistance of the band. Inhale, halfway down. Exhale, lifting up again. Inhale. So if you're not cheating, if your hips are not moving, you can lift up to your own range of movement. Okay, but I want both legs to be aligned next. So if you're doing when you do the other leg, so making sure the other side should be aligned too. So breathing up, lifting, breathing in, down, breathing up, lifting, breathing in, down. So just one more here, and let's rest. Good. Now let's bring both legs straight, top hip slightly rolling forward, and this time I want you to bring your hand behind your head, slightly pull your head, pull the tummy, and let's just lift up and back. So doing this, we also strengthening our lats, obliques, pulling the tummy, and these are muscles helps to walk us straight and keeping it a back, a hip, SI joint strong and aligned. So breathing out, breathing down. Last one. Okay, so let's rest here. Now bring that hand forward, hip still slightly forward, and lift the legs up. Inhale down. So both legs up and down. So this time you're letting go the waist. Breathing out, breathing down. See, lots of athletes and lots of people comes to us for just these problems. So after doing 1 or 2 sessions, they feel so aligned. They're so good. Okay, hold it here. 5, 4, 3, 2, and just let go. Yep. Let's do the other side. That's why I thought to make these video series, so people can't come and they have these weak hip back. They can do these exercises from their home, as you're doing now with me. Okay, so arm on the middle, legs on a 90-90, hand here, push the waist and roll that top hip forward. Heels are together, zipping up. Remember, first we're doing activation, so just push that top heel and find that muscle. Exhale, squeeze. Inhale, release. Let's just do a few more. Inhale, release. Again. Inhale, release. So feel you clenching, tightening, and inhale, release. Again. So just only few more exercises left. So just keep working and keep concentrating. Stay focused. Exhale, we're squeezing. We're pretending trying to lift the knee. Remember, we're pushing the heel, pulling the femur, and really feeling these. That's just like this part there on under. It's tightening. And release. Okay, just 2 more. And release. Now this time you're tightening, you're not releasing, so just keep it tight. Squeeze the heel and lift the knee. Inhale, release. Exhale. Keep going. Now see, lots of people, they start looking after themselves or they start doing some exercise. After finding out they have a problem, so they have to go to the physios or chiropractors, and sick and tired going there. It's not a permanent solution. They can fix once or twice, but then after you have to do something. Some people, they just do exercise. They look after themselves, and they don't take this body for granted. Like you take a shower every day, you sleep every day, you brush your teeth every day. It's just every day you're looking after your body. You see, like the birds cleaning their wings, and they, if you go and sit in a park, sometimes you see they exercise. Their parents are teaching, playing with them, showing them how to hunt. But these days we send our kids to the schools and universities and don't teach anything, these kinds of things. Okay, breathe out, squeeze and lift the knee up. Inhale back. Okay, do 2 more. Last one. So it's just the basic trait of human beings. If you see those, we're doing internal hip rotation. Oops, sorry. Just stay there, sorry. We forgot to hold and we forgot to pulse. Go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so hold it there because this one we sort of rushed it. Sorry. And let's rest. Let's do the internal now. If you see dogs and cats, they're always stretching. They're always involved. They're very. They don't go to any school. They don't go to any universities, but they're very they're connected with themselves. As we human, we know about the whole world, but we really don't know about the whole, about just any of our body. For just a few little things we have to go to our doctors, we can fix on our own. So doing these exercises, you can be strong, and doesn't matter you don't have any hip pain or back pain or all that. Doing this exercise, you're keeping your body active and you're keeping yourself young and strong and feeling good, looking good. Okay, push that waist, push the knee and lift the foot. Inhale, release. Exhale, lifting up. Inhale, release. So all that talk is just to keep you motivated. But sometimes people ask, they say like, why it's me only in the whole family looking after myself? And I said, because you're aware, you want to look after you, you want to take your own responsibility. Okay, so you're not a liability. Good. All right. 2 more. Last one. And rest. So it's a good thread. Let's taking off. So both legs are together, so sort of on the edge of the mat, and roll the hip forward, pull the tummy, and pull your head back. Pull the tummy. Exhale, lifting up. Inhale and back. Inhale and back. Keep going. Few more. We almost finished. Just a few more exercises to go and then we're done. But you're doing such a great job doing exercise, looking after yourself. Okay. Last one. So just pause up there for a little while and let's rest. Good. Okay. So bring this hand forward, hips slightly rolling forward, so sort of we're using more of the back, not the front muscle. So breathing out, lifting, and breathing in, down slowly. Exhale, inhale, down. Doing good. Inhale, down. Let's keep going. Just one more, and just want you to hold here for 5, 4, 3, 2, and let's rest. Beautiful. Okay, you can have a little drink if you want. Just the last exercise on the side. So it's a side series, it's a hip series, so there'll be lots of side exercises. But these ones are last. Now going to do a side hip lift, and then we're going to do a little bit more activation. Nice. Okay, so I want you to come onto your elbow, and it's sort of feeling like elbow staying under. Now here, sort of feel like your knees and hips are aligned here, and your bottom hip slightly forward. Feet are together. You can place that hand here. You can use this hand here to help to lift, all right? Or you can just keep that arm straight, resting as I'm resting. So inhale down. So it's a beginner level. If you're strong, you can keep your legs straight. But if you're just starting up, you can keep the legs bent. Exhale up, inhale down. So inhale down. There's some sort of teaching, so I'm just going to stay on the same level. Just 2 more. Last one. So hold it here. See, up, hold, and squeeze your heels and turn the knee out. Inhale back again. Doesn't matter you're using a band or not. Okay, so you still pushing that heel, feel you pulling that femur to the hip socket and helping strengthening that hip joint. This is a little tendon that inside the hip called a greater truncator. So it's just really pulling that, strengthening that, all the muscles around the hip pulling, helping, strengthening, building the ball and socket. And as we're moving, we're building. Okay, let's rest. That little band around, just lots of oxygen and blood flow and nutrition around those little ligaments, tendons, and the fluid. Okay, so arm here. Always bring the elbow slightly under. Good. Your feet back and the hip forward. You see, now you can place the hand here. If you're feeling weak, you can place the hand here. You can place the hand here. Okay, so wherever you're feeling, feel that shoulders are stable. Exhale, lift. Inhale, slow down. It's more of your back you're feeling instead of front. So the bottom hip this time slightly forward, and then the top hip is the back. Okay? And hold this time. So stay. Squeeze that heel. Feel you pulling that femur to the hip socket, and you tightening, strengthening. Few more. Tummy in and hold, and let's rest. Down slowly and rest. Okay. Now we're done with the band, but just the last two exercises, and then we're going to do some just stretch, just 2 or 3 stretch, and then we're done. You're doing such a great job. Okay. So the reason wearing a tight pant is just to show you guys the technique and the right exercise. So that's what Pilates we normally do. Okay, so just a simple plank on all 4. Feet and knees are hip width apart. Now I want you to pull the shoulder and looking slightly forward and pull your head back. Now the plank teaching to maintain a neutral, make a neutral spine. So I want you to feel your shoulders are slightly pulled away from your ears, neck along, arms are straight. Now start focusing, start feeling you lifting your tummy up. Now you feel you, as you're breathing out, you're zipping up the pelvic floor, and as you're breathing out, you're really lifting your belly button to the spine. So feel every time you're breathing up, your spines are staying straight, neutral, but you're pulling your belly button, really lifting your tummy up to your spine. So you're bracing your spine and helping, strengthening your core. So it's a weak core always. So it's not dropping down. You feel like you're lifting up towards your spine. So 10 more seconds. Looking slightly forward. Don't let your head drop. Okay, so from here now, we're going to do the plank. So it's just because it's the first video, we're going to do the plank on the knees. If feeling strong, you're used to doing a plank, you can go on your toes, all right? So hands are shoulder width apart. Feel both arms are strong. And staying on the knees. Good. You can keep your feet like this, align. Yep. Maintaining, sort of maintaining a neutral spine. And then the same what we were doing there. So slightly tuck and feel like you're clenching both of your buttocks. Zipping up, pulling the shoulder and looking slightly up. Now just with the zip, breathe out, you zip up the pelvic floor, pull the tummy and hold it strong. Strong arms. Buttocks are staying even. Engaging the core. Now, if you have any knee trouble, you can just put a little blanket under the knee. You can use a cushion. And if you're strong, you're used to do the planks, you can just go on the toes. Okay, come down to the knees. Push up on your hands first, coming up. So never just dropping down to the floor. Okay. Knees are slightly wide. Feet are here. We're just stretching our back on a shell stretch. You just rest there for a little bit. Keep the head down. I'll just set my mat for the next stretch. Just stay there for another 10 seconds. Breathing in, breathing out. Good. Now just come up in all four. Just last 3 stretch. You've done a really good job. Okay, so you're facing me. In case you need a more cushioning, you can double up the mat. And if you have any knee trouble, use a cushion. You can use a blanket to support your knees. All right. So now just bring the left leg forward. Now, once you're here, I'll turn you. Stay here. So your right leg forward, left leg here. I'm just going to show you here. So that left knee, left hip is aligned, and the hands are here. And I want you to just gently tuck your tailbone in and feel that stretch coming onto your hip flexor. We're holding here. Now roll your shoulders back. You can keep your both hands onto your knee. Now, in case with the sort of lack of balance, you can always use a chair to help. Now, remember with this stretch, so this is the right way, and I show you the wrong way. Not doing this and not going like this. So this is the wrong, alright? So always keep that knee and hip aligned. We're tucking in, squeezing, and feel we're lifting the buttocks. We use that muscle, so we're tightening this. So we're tightening this to lengthen this. So feel we keep lifting that hip up, holding here, and opening, lengthening. Now just hold it there, and I just lift the left arm up, keep the tummy in, and just slowly stretch onto the side. And I just come back. Good job. Okay, let's do the other side. Yeah. Now, this is again a right technique to show you guys where people always do the wrong. Now, see that knee and hips are staying 90 degree, and there's a habit of people stand like this on the one hip. Okay, so when they go even on this position, their hips are down. So what I want to do is you see yourself, that knee and hip is at 90 degree, and then you start tucking in. So tucking is you pushing that hip, and raise your chest and push that weight back onto your foot, and push that hip forward to lengthen that hip flexor and quadricep. Hold it here. So keep tightening, keep pushing, and that will help you to open these muscles. So see, these muscles get tight sitting a lot. And the same, we're running, we sort of leaning forward, we bending forward, we squatting, that's we always hinging hip back like this. So it's just opening and lengthening the quads. Nice. Okay, so let's just lift your arm up, pull the tummy, and just stretch on the side slightly. And rest. Good. Okay, so let us sit facing me. Both legs are straight. Nice. Now I want you to bring your right leg up like this and arms are behind. So leaning back and just bend your left leg. Still keeping your tummy in. Inhaling, exhaling deep. Sometimes in the classes, look, it's been almost 23, 24 years of been teaching exercise. In most of the classes, in most of my experience, once people done exercise, they just walked out. They just walk out and they don't do enough good stretching. The stretching is as important as exercise itself. Breathing in, breathing out, hold the stretch deep. So breathing in and breathing out deep is helping you to relax. It's bringing you back into that natural state, because we're not exercising anymore. So slowly bring your heart rate down through the power of a suggestion and mind. Bring your blood pressure down as well. Start becoming more relaxed, more calm, and more mindful about the body. Start feeling good now, inside, outside. Okay, let's relax. Switch. Okay, so lowering that knee down slightly, sitting up tall, and I just bend the right leg, keeping both hip aligned, holding here, not forcing onto a stretch. And breathing in. While doing a stretching exercise, it's just the positive, I say positive enforcement. Just feel like, you saying thank you to your body for moving well, for serving you, doing all it does. Such a wonderful machine. Saying thank you to yourself to making time, looking after you and doing something and moving. Okay, let's rest. Just last stretch now. Okay, so feet and knees hip width apart, and the hands are behind your legs. So relax the shoulder. You can stretch your legs shoulder width apart, so you can keep those hips relaxed. So breathing in and raise your chest up, lengthen your spine and look up. We call it armchair stretch. You can keep your hands here, or you can keep your hands behind your legs, keeping the shoulders relaxed, looking up. And as you breathe out, slowly curl your back, looking down. Okay, 4 more. Look up, chest up. Open up the spine and lengthen. Three more. just the little sacrifice for a good health. And it's not a sacrifice, it's your investment for a good life, a good health. You see, relying on others, like the specialists, doctors, and pharmacies, painkillers, relax. It is, okay, so that is facing me, cross your legs, and then sitting, relax the shoulder. Okay, roll the shoulders, breathe in, lifting the arms up, chest up. You see, arms up, and exhale down. Inhale, exhale, arms down. So both hands are here. Lift the right arm and stretch on a side. Inhale back. Every morning when we start a job or work, we start thinking or wishing or praying to the God we get the work. The same as the doctors and the pharmacies asking for more work. So they never want you to get healthy and strong. But it doesn't matter if you get strong, if you get better, there is so many other people. They're never going to run out of the business. Even if you are a doctor or a pharmacist. So look after yourself. That's what my goal is. Okay, so hands here. Let's just roll your shoulders up and roll back. Up and roll back. So more you're mindful about you, the more you're aware about your body asking for the movement or the right movement, right exercise. So that's just back to front. Okay, now lengthen your neck and just slowly turn your head to the right and bring back, head to the left and back. Inhale, exhale. Inhale, exhale. Look up, look down, look up, and look down. Bring your head back in the center. Pull your head and just drop your head down to the right shoulder. It's inhale, exhale, inhale, or whatever you feel now, because you've already done such a great job. So make sure regular exercise or walking, swimming with these exercises really helps. It just reboot all your body. Thank you very much. I'll see you next time. Namaste.